Welcome to Dental Anatomy and Occlusion. If you haven't watched the overview videos for our course, make sure and take a look at those now. They do a great job of laying out how and why we've done things. Dental Anatomy and Occlusion is part of your Big Five, so we're going to get ready to dominate this section. Remember, there's 100 questions in all of Dental Anatomy and Occlusion. Let's focus in on tooth morphology right now. Take a look at this visual with me. I'm really excited because I've done a lot of work for you here, and it's awesome to see how things have played out. We can look at 48 questions that we know are going to be on this section. About 60% of them are on the maxilla, and about the other 40% are on the mandible. So that means that you can expect to see 29 or 30 questions on the maxilla, and if you look down this list, you'll see a lot of teeth just have 1, 2, maybe 3 questions on them, but there's 3 in each arch that stand out. So if you look in the maxilla, the canine has 4, the first premolar has 4 or 5, but man, that maxillary first molar, that's the big one. It's got 6 to 8 questions just on that, plus we're going to see another 3 to 4 general maxillary molar questions. So you're going to see anywhere from 9 to 12 questions just on the one tooth. That's almost a quarter of your questions. If we look down on the mandible, we kind of see the same thing. We see 3 teeth that stand out, the canine, the first premolar, and that first molar again. So seeing this overview, you can see how we've put forth a ton of work into being able to specifically guide you to where your time's the most valuable so you can totally dominate this section. Let's jump right in on the maxillary central incisor. We can expect to see 1 to 3 questions from this tooth. Follow along with me on your visual and I'll point out some key features. This tooth has the greatest axial inclination of all the anterior teeth. You'll note in the facial view that this tooth has 3 mamelons. These 3 mamelons form because it is developed from 4 lobes. 3 of the lobes form the mamelons. The 4th lobe forms that cingulum you can see on the lingual view. Taking a look at the incisal view, you'll notice that the mesial distal width is greater than the facial lingual width. We see this asked in questions, often combined with a question about the mandibular molars because they're also wider mesial-distally than they are facial-lingually. If you take a look at the proximal views, note that this has a triangular outline, as do all of the incisors. In the cross-section, you see that this tooth has a round single canal. Note that the incisal edge of this tooth is centered over the root. Make sure you can identify this tooth in cross-section, especially looking at its pulp chamber. You see where it has the 3 lobes of the pulp chamber that correspond with the 3 mamelons. Note that when it has the sharp points to each of those lobes, it is the pulp chamber of a young person. That's contrasting to an older person because remember, as we age, we continually lay down dentin. So if you see that image, know that it's a central incisor of a young person. Now let's look at the maxillary lateral incisor. We can expect to see 2 questions on this tooth. Let's take a look at the diagram. In terms of form, this is the most widely varied anterior tooth. Notice I said anterior because the 3rd molar is the most varied overall. If you look at the facial view, it often comes in a peg-shaped form. This is also the most likely tooth to be missing. The most distinguishing feature of this tooth is the distal lingual groove. We've only got 2 questions here, and I can almost guarantee if you have a question, it's going to be on this distal lingual groove. Highlight it, mark it on your image. Know that it complicates scaling and root planing, and that at the apex of that groove, there's a lingual pit that forms that caries often forms in. So remember that distal lingual groove. Let's look at the maxillary canine. Remember, for the maxillary teeth, this is one of the top 3. We can expect to see 4 questions just on this tooth. So let's take a look at the diagram there, and I'll point out a few of the top features. This tooth is the least likely tooth in the mouth to be lost. Its lung axis is nearly vertical. And we'll talk about later in occlusion how this plays a very major role. They don't call it canine guidance for no reason. This tooth has the longest root, has a very prominent cingulum, and is very thick facial lingually. All these factors play together to allow it to support its vital role in canine guidance. When taking an x-ray of this tooth, you'll notice that it acts like an anterior tooth on the mesial and a posterior tooth from the distal. the cusp tip is offset. If we look at it from different views, we'll notice that the cusp tip is both facial and mesial of the midline. Make sure and be able to recognize this tooth from the facial aspect. Remember, there are 4 questions over this tooth. All these points I've just hit have been pretty evenly distributed over past tests, so you're going to nail them all. Let's take a look at the maxillary first premolar. This is one of our other big 3 in the maxilla. We can expect to see 4 to 5 questions on this tooth. Let's take a look at the diagram together. Take a look at this tooth from the facial view. You notice that it has the longest crown of maxillary posterior teeth. The buccal cusp of this tooth leans towards the distal. So if we were to look at the maxillary first and second premolars together, it would look like the cusp tips were leaning towards each other. The second premolar leaned towards the mesial, and this one, the first premolar, leans towards the distal. Mark that right there on your diagram in several spots. This tooth also has a mesiolingual developmental groove. They love to ask questions on this. Make sure and know this. They'll ask about it complicating scaling and root planing. They'll ask about it complicating restoration on an MO restoration. Make sure and highlight it. They also like to ask it in identification of this tooth. So take a look at that mesial view. Make sure you can recognize the mesial from the distal. Make sure and look at that occlusal view. See how that developmental groove runs over the mesiolingual. Make sure and identify that and be able to tell which tooth is on the right and which tooth is on the left simply from that mesiolingual groove. The other view you need to recognize is that mid-root cross-section. This is the only premolar that's going to have 2 roots. So when you see those 2 roots together, it's a slam dunk that this is the first premolar. You can see from all these views this tooth has 2 spindly roots. It can be a real challenge to extract because they like to break off if you're not careful. The axial inclination of the roots is nearly vertical in this tooth. Let me come back to that mesiolingual groove because of all the questions, you're going to see definitely more than 1, maybe 2 or 3 on that mesiolingual groove alone. So know it, identify it, own it, and dominate it. Let's take a look at the maxillary second premolar. We can expect to see 2 to 3 questions just on this tooth. Let's take a look at the diagram together and point out some key features. Note that the buccal and lingual cusps are almost the same height on this tooth, which varies widely from that first premolar. The buccal cusp on this tooth leans towards the mesial. We just talked about that in relationship with the first premolar, where the first and second premolar, the cusp tips, the facial cusp tips, lean towards each other, meaning this one goes towards the mesial, the first premolar towards the distal. Looking at the occlusal view, you will see that this tooth is wider facial-lingually than it is mesial-distally. That's important in identifying it relative to other premolars. Take a look at the cross sections of this tooth. This tooth does have 1 root with 1 canal. It's easy to take out, and it's easy to do endo on. I refer a lot of molars out in my practice, but love doing endo on this tooth. Let's take a look at the maxillary first molar. Remember from our breakdown, this tooth has the greatest emphasis of all the teeth on your test. We can see 6 to 8 questions on this tooth alone, plus 3 to 4 general molar questions. That means you're going to see anywhere from 9 to 12 questions on this tooth. So it's a big one. Let's take a look at this diagram. The maxillary first molar is the largest maxillary tooth. It has a huge mesiolingual stamp cusp. That mesiolingual cusp is so large that it leaves the distal lingual cusp very small. The mesiolingual cusp forms an oblique ridge as it heads into the rest of the tooth. This tooth frequently has a cusp of Carabelli, as you'll see there on the lingual view. Decay often forms right above this. This tooth has a very prominent lingual groove, and you'll frequently see decay down that lingual groove. This tooth is rhomboidal in shape with an obtuse angle around that large mesiolingual cusp. That large mesiolingual cusp also forms a primary cusp triangle with that mesiobuccal and the distal buccal cusps. This tooth features a prominent root trunk concavity there on the distal. This can again pose a problem either when you're restoring the tooth, getting your band to adapt, or when you're scaling and root planing. I can pretty much guarantee you're going to have to identify this tooth in a lineup at least once on your test. So make sure and know all of these views. Take a look at the mesial view. Especially look at the roots and see how that mesiobuccal root hides that distal buccal root. Also note that you can see the cusp of Carabelli in that mesial view. When you're looking from the distal view, we can see that distal buccal root is small enough that you can still see the outline of the mesiobuccal root behind it. Taking a look at the cervical cross-section, we can see the three roots, and note that broad, flat mesiobuccal root. There's normally 3 canals in this. If there's a 4th canal, it will be in that mesiobuccal root. Looking at the cervical cross-section, note that the pulp chamber is triangular in shape with its longest leg from the palatal to the mesiobuccal. Another tricky way we've seen them ask how to identify this tooth is by identifying a cavity preparation. Remember that big oblique ridge? It frequently separates this into 2 preparations, where you'll have a central fossa like this and a distal fossa that extends into that lingual groove. Make sure you can identify this as a maxillary left or right molar based on this preparation. So hang with me, guys. We're almost through this tooth. Remember, this is the largest tooth in the maxilla, has the most questions. We've hit a bunch of points. We've got a few left. Let's take a look at the roots. This tooth has a very distinct trifurcation. Note that the palatal root is very large and very long. The mesiobuccal root is flat and sometimes has a 2nd canal. The distal root is the shortest and the smallest. When extracting this tooth, you want to be very careful because this is the tooth that's most likely to result in a sinus exposure. Let's take a look at the maxillary 2nd molar. We can only expect to see 1 question. We can see 3 to 4 general molar questions, but most of those we've already hit in the 1st molar. So really 1 question coming out of this. Let's take a look at the diagram together. This tooth is very similar to the 1st molar in many ways, only it's smaller. Just like the 1st molar, it has 3 roots with the trifurcation. Still has that large mesiolingual cusp, has a very small distal lingual cusp, just like the 1st molar, and it still has that prominent distal lingual groove. Make sure you're able to recognize this tooth by the cervical and mid-root cross-sections. Note here that the cervical cross-section, the pulp chamber, is very nearly a triangle. The most distinguishing feature of all these maxillary molars is that mesiolingual cusp that's so large. For both the 1st and 2nd molars, if we were to put the cusps in order of size, the mesiolingual would be the largest, mesiobuccal would be 2nd, distal buccal would be 3rd, followed by that 4th small distal lingual cusp. Let's look at the maxillary 3rd molar. It's the last tooth in the arch, and we can expect to see only about 1 question here most years. Let's take a look at the diagram together. The anatomy of this tooth is widely varied. The heart shape of this tooth is the most common, as you can see in our occlusal view. It only has 3 cusps, and the distal lingual cusp is missing. About 20% of people are missing at least 1/3 molar. I wasn't that fortunate, so for the rest of us, we're likely to get food trapped behind there, which makes the gingival tissue very inflamed. If this tooth is fully erupted, it is very easy to extract because the roots are usually fused together and they curve to the distal. Let's take a look at the mandibular arch now. Remember that diagram we started with, breaking down our questions? Let's take a look at that again. The mandibular arch, remember we're going to see 18 or 19 questions. There are 3 teeth that are emphasized more than the others: the canine, the 1st premolar, and the 1st molar. So let's jump in and make sure we nail those 3 teeth. Let's look at the mandibular central incisor. We can only expect to see about 1 question here from this tooth. Let's take a look at the diagram together. Note that this tooth is the smallest tooth in the mouth. Remember, just like all incisors, from a proximal view, it does have a triangular outline. This tooth is very wide facial-lingually. It has mesial and distal root depressions. In cross-section, its pulp chamber is very flattened in shape. Let's take a look at the mandibular lateral incisor. Most years, They only ask one question, sometimes none at all. Let's take a look at the diagram and see what they're going to hit. This tooth is a little bit wider than the central incisor. When you get a question on this tooth, I can almost guarantee it's going to be identifying this tooth from the incisal view. So let's take a look at it. Note how it's twisted a little bit towards the distal, has that rotation to it. Make sure and know it, and you're going to nail this one. Let's take a look at the mandibular canine. This is one of the big three in the mandible. We can expect to see 2 to 4 questions on this tooth alone. Let's take a look at the diagram again. This tooth has the longest crown of any tooth in the mouth. The mandibular molar, along with the maxillary molar, are the least likely teeth to be lost in the mouth. This tooth acts like both an anterior tooth and a posterior tooth. On the mesial portion, it is flat like the incisal edges of the anterior teeth. The mesial portion of the crown is also parallel to the root. The cusp tip is displaced to the mesial, while the cingulum is displaced to the distal. While this tooth frequently has a round single root, it also may be bifurcated. Let's look at the mandibular first premolar. We can expect to see 3 to 4 questions on this tooth. Let's dig into the diagram. You can see how this tooth has a very undeveloped lingual cusp. It also has a very prominent mesiolingual developmental groove. This tooth frequently has separate mesial and distal pits, which, when they're decayed, need to be restored separately. Looking at the mesial view, you can see that one question they really like to ask is that mesial marginal ridge is located more cervically than the distal marginal ridge. Make sure you can identify that and know that for your test. Taking a look at the proximal view, you'll see the steep inclination of that occlusal table since that lingual cusp isn't very developed. Note that the occlusal table develops a 45-degree angle with the long axis of the tooth. The last thing I want to point out is that this tooth has a single round straight root. Let's look at the mandibular second premolar. We can expect to see 1 to 2 questions on this tooth. Let's take a look at the diagram. This is the only premolar you can expect to see 2 lingual cusps on. Taking a look at the occlusal view, you'll see how those lingual cusps form a central pit. This is in contrast to the first premolar, where it formed 2 separate pits that had to be restored separately. When this tooth is restored, it usually follows a U or crescent shape following the groove, as you can see there on the occlusal view. Let's take a look at the mandibular first molar. We can expect to see 3 to 4 questions on this tooth. This is the biggest tooth in the mandible in terms of questions. Let's dive right in and take a look at that illustration. This tooth has the greatest mesial-distal dimension of any tooth. Looking at the occlusal view, you can easily distinguish 5 cusps. The largest is the mesial buccal cusp, and the smallest is that 5th distal cusp. Note on the facial view, this tooth frequently has a buccal pit, and it's likely for caries to form there. The mesial-distal dimension of this tooth is greater than its facial lingual dimension. Do you remember 2 other teeth we talked about that have the same characteristic? Good job, guys. The maxillary central and lateral both are wider in the mesial-distal dimension than they are in the facial lingual dimension. This tooth has 2 large, clearly distinct roots. If you look at the mid-root cross-section, you'll see that the mesial root typically has 2 canals. We'll talk about this more when we discuss the curve of Spee and curve of Wilson, but remember that all mandibular molars incline to the lingual. One last point, I've got a little tie-in from your gross anatomy that we've seen on old tests here. Make sure and note that the root apices of this molar lie below the mylohyoid line. Let's take a look at the mandibular second molar. We can expect to see 2 questions on this tooth. Let's jump right into the diagram. Note how symmetrical this molar is. It is actually the most symmetrical of all the molars. This tooth exhibits 4 cusps. Make sure you can identify this tooth from the occlusal view. Note how the occlusal grooves form a plus sign. I want you to take a look at the facial view next. Make sure you can identify this tooth from that view. Note its distinctly separate roots and the symmetry of its four cusps. Just like the mandibular first molar, the mandibular second molar is also inclined lingually and slightly mesally, following that curve of Spee and the curve of Wilson. And remember, for all these molars, the apex lies below the mylohyoid line of the mandible. Let's look at the mandibular third molar. A lot of years you won't even see a question specific to this tooth. You're more likely to see a general question about third molars. Remember that about 20% of the population is missing a third molar. Third molars are the most widely varied tooth in the mouth in terms of both coronal structure and root form. And the most likely cause of extraction, or reason we take these out, is pericoronitis, where you get something stuck behind it and you get chronic inflammation with that flap of tissue that covers it.